Clinical features. Presenting complaints. Often the patient is a child around the age of 9 months. The mother gives a history that the child developed mild pyrexia associated with diarrhea, followed by inability to move a part or whole of the limb. The lower limbs are affected most commonly. Paralysis is of varying severity and is symmetrical in distribution. In extreme cases, the respiratory muscles may also be paralyzed. Often the child is seen by a pediatrician in the early stages. When he is referred to an orthopedic surgeon, the paralysis may already to be on its. Now this is the paragraph of the stages of poliomyelitis. A is incubation period, B pre-paralysis stages, stage C stage of maximum paralysis, D stage of recovery, and the last one is E post-polio residual paralysis. Way to recovery of power if it occurs may continue for a period of 2 years. Most of the recovery occurs within the first 6 months. Any residual weakness persisting after 2 years is permanent and will not recover. For descriptive purposes, the disease is conventionally divided into 5 stages. Examination. There is examination in 2 stages, in the early stage and the late stage. First off is in the early stage. The child is febrile, often with rigidity of the neck and tender muscles. This may be associated with diffuse muscles paralysis. The following are some of the typical features of a paralysis resulting from polio. It is asymmetric, that the involvement of the affected muscles is haphazard. It occurs commonly in the lower limbs because the anterior horn cells of the lumbar enlargement of the spinal cord are affected most often. The muscle affected most commonly is the quadriceps, although in most cases it is only partially paralyzed. The muscles which most often undergoes complete paralysis is the tibialis anterior. The muscles in the hand affected most commonly is the opponent's pollicis. The motor paralysis is not associated with any sensory loss, bulbar or bulbospinal polio. This is a rare but life-threatening polio where the motor neurons of the medulla are affected. This results in involvement of respiratory and CVS centers and may cause death. In the late stage, the paralysis may result in wasting, weakness and deformities of the limbs. The deformities result from imbalance between muscles of opposite group at a joint or due to the action of gravity on the paralyzed limb. The common deformity at the hip is flexion, abduction, external rotation. The knee flexion deformity is common in severe cases. Triple deformity comprising of flex deformity is the commonest. The flexion, posterior subluxation and external rotation occurs. At the foot is equinovarus deformity, and the upper limbs polio affect shoulder, elbow muscles, hands, and usually spared. Limb may become short.